All right, looks like it is 12 o'clock here in Fort Atkinson, Wisconsin, where we're located, and I would like to welcome you all to today's webinar. My name is Abby Bauer, and I'm an associate editor for Hoards Dairyman magazine, and our team here would love to welcome you to our monthly webinar series, which is co-hosted by Hoards Dairyman and the University of Illinois. Today's webinar is titled Mastitis Management Through Milk Cultures, and our presenter is Dr. Mike Zurakowski. He's a veterinarian who works with Cornell University's Animal Health Diagnostic Laboratory. We're very pleased to have him with us, and he is here to teach us about milk cultures and how you can use that to determine mastitis treatment in the dairy herd. This month's webinar is sponsored by Ozalea, and we'd like to thank them for their support of this program. If you're listening to the presentation today, you can print out a copy of the slides. Those are available in the handout section of the GoTo control panel. If you look down there, there's the option to print off 2 PDFs. They have the slides of Dr. Zurakowski's presentation and also some information about our sponsor. So please go ahead and print yourself a copy if you'd like that to take notes on or have for future reference. I also want to point out that if you have any questions for our presenter, you can type them in the questions section of the GoToWebinar control panel as well, and we'll answer those after the presentation. Our webinar team consists of Jim Baltz at the University of Illinois and Patty Hirchin, our online media manager here at Hoards, and we thank them for their behind-the-scenes work to help make everything run smoothly for these monthly webinars. I also want to welcome my co-host for today, and that is Mike Hutchins, a professor emeritus from the University of Illinois, and we're always thankful to have him here to co-present these or co-host these webinars. So Mike, I will turn the presentation over to you to introduce Dr. Zurakowski and begin the webinar.
Well, thank you very much, Abby, and it's my pleasure to introduce Dr. Mike here to our listeners here today. He grew up in Maryland and got his bachelor's degree at the University of Maryland, and then got his D.V.M. at Ross University. He has been heavily involved in terms of being a senior extension veterinarian for the Quality Milk Service Program with Cornell University's Animal Health Diagnostic Lab since 2005. He's also the director of the QMPS Eastern Regional Lab in Cobblesville, New York. So he has lots of professional activities, including his professional activities include mastitis, microbiology, foodborne pathogens, and on-farm security. So Dr. Mike, we'll turn the program over to you, and you're off.
Thank you, everybody, for coming and spending some time with me today to talk about mastitis, milk cultures, and how we can use these to better manage mastitis, clinical mastitis that we see on our farms. I thought we'd start today talking a little bit about mastitis and define it, and spend a few moments going through the pathogenesis or the process of this disease. And then we'll talk about milk cultures and pathogen detection, trying to identify the organisms that are responsible for mastitis on our farms. And then once we know the organisms that are causing mastitis on our farms, we can look at the risk associated with how these cases of mastitis are occurring, why these organisms are gaining access to the mammary gland and causing infections. And then finally, we can put it all together to talk about ways of developing methods or practices to manage and prevent mastitis. First, a moment to talk about the definition of mastitis. And over the years, I've realized this is kind of a complicated technical definition. If we break it down, the first part of the word mast coming from breast or mammary, and the second part, itis, referring to the inflammatory disease process. And so if we look at mastitis from an immune standpoint, it's a series of very involved, complex immunological events. And we can have chronic cases of mastitis where we have organisms that are embedded in epithelial cells, that are embedded in scar tissue, embedded in immune cells that perpetuate these infections over time. We can have transient mastitis infections or short-term infections where we have bacterial invasion and an immune response that eliminates it. And then we can have more septic mastitis cases where these organisms gain access to the bloodstream, circulate through, and raise havoc with all of our major organ systems in the animal. But then there's more to the definition. One is the clinical definition, what we see on the farm when we're out there. We can see abnormal milk, flakes, clots. We can see swollen quarters. We can see other flakes and debris and stuff on milk filters. And then finally, there's what I call the bacterial definition. And this is when we take these milk samples and we put them on culture media, trying to determine the origin of these infections. What we're looking for are true infections and not background bacteria. So if we look at this culture plate here, we see that these organisms, which is a coagulase negative staph or staph species, they're all the same color, same size, same shape. And so without a doubt, we can say that the mastitis in this animal is caused by this particular organism. If we look at this plate, there's a variety of different bacterial colonies. Some are white, some are yellow, some are big, some are small. So for us to identify what's causing that case of mastitis from this culture, we're not going to be able to do that. So from a bacterial standpoint, we want to identify true infections with good culture results. So with the disease process, we'll just go real quick about how this process happens. There's a lot more involved, complex processes at work. But to put it all together quickly, majority of the mastitis cases that we see start when bacteria enter the teat end, through the cistern, into the gland cistern, and up into the alveolar tissue. Once they're in there, they can stimulate an immune response where we have an influx of somatic cells or white blood cells, neutrophils and macrophage. And these organisms can be engulfed and destroyed. But they can also invade epithelial cells where they can survive and perpetuate chronic infections. Some organisms like Staph aureus will survive inside the immune cells that are there to destroy them, so we get additional chronic infections. They can do damage to epithelial cell that leads to atrophy of the alveoli and decreased production. And so there's a whole variety of processes that take place. Now, when we think about the bacteria that cause these infections, there's 4 things to think about that these organisms need to survive. One is nutrition. And of course, in the udder, we have milk, which is a great nutritional source. 2, moisture. We have plenty of that in the udder. Warmth from the body temperature of the animal. And we also have to have a proper pH. And most organisms survive at a pH between 6.8 and 7.2. So all the conditions for these bacteria to grow and thrive are in place in the udder and also in the environment in which dairy animals lives. But once they get into the udder and they have all of these needs met, they grow very quickly, exponentially. At some point, they overgrow their environment, start to break down the nutritional content, the pH rises. It becomes an environment that's not ideal for them, and then we see a death phase. Some of these organisms, again, will invade different cells, different scar tissue, et cetera, and can perpetuate these long-term chronic infections. So that's what we're looking at when these organisms invade the mammary tissue. Now in there's a couple of processes that take place. So this is a blood vessel, and inside the blood vessel are these polymorphonuclear cells or neutrophils that are rolling along looking for foreign organisms that should not be there. This is the mammary tissue, and here we have a macrophage, which acts as a leader or a general in an army. Its job is to identify bacteria and other foreign substances that aren't supposed to be there and mount an immune reaction. Here we have a picture of a macrophage with these long tentacles that are sweeping the area looking for organisms that aren't supposed to be there. When they encounter them, they start an immune process with the release of cytokine or signals that act on the blood vessels supplying that mammary tissue. That site at which they act becomes sticky. So these rolling neutrophils that are rolling along stick to that site, squeeze through the gap junctions of the blood vessel, and invade the area to attack and destroy the bacteria. In that process, they bring salts and other ions, which cause a shift in fluid. So in that quarter, we may see that the quarter starts to swell up. And because it starts to swell, it puts pressure on the sensory nerves that are there, and so that becomes painful. So this animal, as the fluid flows in, the milk becomes abnormal. As the immune cells come in contact with the bacteria, we start to see flakes and clots and abnormal milk. And so we see all these clinical signs of mastitis during this process. Here's a picture of a neutrophil with the folds on the surface, and their job is to attach to the organism and fold over it to encapsulate and destroy it. So that's the process that we're talking with, real quick format. Next, we're going to get into milk culturing and detecting the pathogens that are responsible for mastitis. And what we see is every farm has its own breakdown of organisms. On some farms, we see higher levels of coliform bacteria such as E. coli and Klebsiella. Other farms, higher levels of strep organisms. And so every farm has its own demographic or breakdown of these organisms. And each organism has its own face and name associated. My interest has always been to identify these organisms, and then once we know these organisms, try to figure out what the risk factors are that are associated with allowing these organisms to cause these cases of mastitis. So we're going to go through this process. First, as far as determining what organisms are causing mastitis, we've got a couple of methods. One, we can take a milk sample from a bulk tank, and so this is a great screening method, especially for some of our contagious pathogens. And we have various medias that we can take that bulk tank and set it up on various medias that will grow specific types of organisms. So if we're looking for coliform organisms, we can set it up on this McConkey media. If we're looking for strep organisms, we set it up on an Edwards plate. And here's Hayflick's media for mycoplasma. But then we can break it down even closer to try to get more in tune with the organisms that are causing the clinical cases on our farm. So we can take individual cow samples where we take a composite sample or a little bit of milk from each quarter. We can also take quarter samples. So we have a clinical case of mastitis, we take that sample, put it on media, and we can identify the organisms responsible. Now, there are a variety of different milk culture methods that are available commercially. Here's a picture from our lab, and you can see the different types of media that we routinely use. There are different selective media. Here's biplate, triplate. There's also quad plates where we can identify types of bacteria. So on the biplate, we have media that will allow gram-positive organisms to grow on one side and gram-negative organisms to grow on another side. Maybe our treatment protocols or our management protocols are set such that we're only looking at organisms as far as their gram-positive nature or gram-negative nature. In the triplate, we pull out strep organisms, as we know that strep organisms have a tendency of better cure rates when it comes to antimicrobials. This is chromogenic media, where depending on the organism and different compounds in the media, the organisms change different colors. So this may be an E. coli that changes this pinkish color. So it's called chromogenic media. We also have on-farm and in-clinic, vet clinic, PCR diagnostic systems that are available. So we can look at the DNA and look for bacteria based on their DNA. And this machine here, this is a Multitoff. So this is a machine in which we can take we can grow organism up on a plate. We can put it into the machine, and based on how the organism reacts to the laser, we can look at genus and species of those organisms really rapidly. So there's a variety of different types of culture methods. Each one has its own limitations and also has its own benefit. The limitations might be cost, might be how much time it takes for us to identify these organisms. But for the most part, from a time standpoint, we're talking 24, 48 hours. Aside from looking at these organisms at the DNA level with PCR, at most every other culture method requires taking a milk sample and putting it onto a growth media. And the growth media has all of those components necessary for bacterial growth. We've got nutrition source here. We put it into an incubator that's warm and has a high humidity in there, and also the media has proper pH. So all the components that would allow for bacteria to grow. We can have an incubator that costs tens of thousands of dollars, like we have in our labs, or we can also set these up this is an egg incubator, a chick incubator from a farm, an on-farm culture setup. And so we do trainings. There are folks that will help train for on-farm culture, in clinic culture, and of course then we also have diagnostic labs all across the world. From a microbiology standpoint, one of the first things we do in identifying pathogens is to group them into their nature, as far as their nature of their cell wall. We have gram-positive organisms, and here's some common gram-positive organisms. We also have some gram-negative organisms, and this is based on their staining patterns. There's their cell wall, which we'll talk about in just a minute. We also have some fungi, some yeast and molds. We have an algae that has become an increasingly important mastitis pathogen in the dairy world. And then we also have single cell organisms such as mycoplasma. One of the first things we do when we're looking at organisms is decide whether they're gram-positive or gram-negative, and that's based on the staining pattern of their cell wall. So in the 1800s, Hans Christian Gram developed a staining technique that can differentiate the gram-positive organisms from the gram-negative organisms. So here's the different types of cell walls between the two. Basically, using crystal violet stain and counter staining with safranin, what he found is that our gram-positive organisms will stain with a purple color. Our gram-negative organisms will stain with this pink color. And so it's one of the methods that we can differentiate these types of bacteria. But when we look at the plate, there's some differences as well. If we look at our gram-positive organisms, you see that they tend to be, for the most part, smaller in nature. This is a 48-hour culture. They tend to be a little bit smaller, distinct borders, versus the gram-negative organisms tend to be larger, more wet, more mucoid. And what you find is after you've looked at many cultures over the years, you're pretty good at differentiating the gram-positive and gram-negatives just based on the morphology of the colonies on the plate. As we go through the pathogen identification process, in addition to observing the cultures, both with our bare eye and also under the microscope, we also have a battery of biochemical tests, whether they be enzymatic reactions or fermentation of sugars. We've also got some immunological tests that we use to differentiate some of our streps. And then, of course, we've got the MALDI-TOF, which is our newest tool in bacterial identification for giving us genus and species of these organisms. So that's from the microbiology side. Now, from the farm side, or from the everyday side, cow side, one of our biggest interests is, are we dealing with contagious organisms? Are we dealing with environmental organisms? So when we talk about contagious organisms, we're talking about organisms that once they're in an animal can be transmitted to another animal through the milking machine, through your hands, with milk on them. Often these are transmitted mostly during milking. And when we deal with these contagious pathogens, the most important thing is to identify which animals have them and which animals do not, so we can protect those animals that don't have them from getting them. And we have a couple of ways of doing that. We can segregate the infected animals. We can put them in their own group. We can milk them last. We can milk them with a separate unit, so we're not transmitting these organisms from one animal to another. Some we can treat with antimicrobials. Some, probably the best scenario is to cull those animals. But bottom line, the most important thing with the contagious pathogens is to protect those that are uninfected from becoming infected. From the environmental mastitis pathogens, these organisms come from the environment, and the environment in the dairy industry or dairy world has all of those components that bacteria need to thrive. So we've got plenty of organic matter, which is a great nutrition source. We've got warmth, whether it be where the animals are lying or because of environmental conditions. We've got plenty of moisture in the dairy farm, and generally bedding pH is good for bacterial growth. And so these organisms come from the environment. They're generally not transmitted from animal to animal. They're usually picked up either during milking, if we don't do a good job of prepping teats, or after milking, when the animal goes and does whatever it does until the next milking, it can pick up these organisms from the environment. So once we know the types of organisms, environmental organisms we're dealing with, we can figure out where they're coming from, and we can find a solution to preventing it. So to break down these organisms, we've got some contagious organisms. Our most common that we deal with are Staphylococcus aureus, Streptococcus agalactiae, and Mycoplasma. We also have a whole bunch of environmental agents. And then we've got some that are kind of in between. Prototheca is that algae that is often picked up or can be picked up from the environment into the animal. And once it's into a dairy animal, it can be spread from animal to animal through milking system. In total, we have about 100 organisms that can cause mastitis in dairy animals. These are some of the more common that we culture on a routine basis. So if we look at clinical cases of mastitis over time, here's 7,500 cases of mastitis, and you can see the different organisms that, that we cultured at this particular farm. About 3/4 or 73% are Klebsiella, Streptococcus galactica, Strep uberis, E. coli, and no growth. And what we find on a lot of farms is, although we can have a whole variety of organisms, there's usually a handful that are the most commonly the problem when it comes to mastitis on a farm. And the percentages of these organisms, it varies from farm to farm. Again, every farm has its own breakdown. But one thing I want to point out is this no growth. And this is a question that we get all the time. Here on this particular farm, almost 30% of the clinical cases of mastitis were no growth. And this is a question we get all the time, is what do you mean it's negative? I took this sample, it looked horrible, and you're telling me there's no, it's negative for culture. And the reason being is, as humans, we're really good at identifying inflammation. We're really good at identifying the influx of immune cells into the quarter, and these immune cells gobbling up organism. We're great at that. And in that process, of course, the bacteria that are being gobbled up are being encapsulated in the immune cells and killed. And so when we see these, especially these very clinical cases, a lot of the organisms that are there are already dead or encapsulated. So when we put them onto our growth media, we get a negative culture result. Had we taken that sample a few days earlier, we'd probably have a beautiful culture to look at. And what we see is 20 to 30% of all clinical milk samples are culture negative. If you're submitting a sample or culturing on farm or in clinic, and you always are getting an organism for your clinical sample, something's not right. And let me prove it to you. So here are 8 farms, A through H, and here's the breakdown of the organisms on these 8 farms. And so if we look at Klebsiella specifically, on this farm, Farm C, it's 19% of the clinical cases are Klebsiella. Farm H, Klebsiella only accounts for 1%. So again, there's a huge variation between farms. But one thing that's pretty consistent is 20 to 30, this one almost 40% are all no growth. And it's amazing. Every year I sit down and look at all the clinical results on various farms that we deal with, and we always see this section of no growth. So it's a common occurrence. And here's a question that we got about, we culture milk samples at our in-house lab. About 40%, which is right in our target there, of the samples show no growth. These no growth cows stay in the hospital pen almost as long as other microbiological positive cows. And what are your thoughts? And so with this, remember, the immune system is doing its thing. The immune response is going on. And depending on the organism, that immune response can take 2, 3, sometimes 4 weeks for the abnormal milk, for the immune response to come and go. And so it is it's very common for, even though we have no growth, the immune response is still taking place, and these animals are still going to end up in the hospital pen because the milk is still going to be abnormal for some time, even after the infection or the inciting cause is is over. So from a diagnostic standpoint of mastitis, we need good samples, we need good collection, get good laboratory practices so we don't contaminate the sample in setting it up. And that gives us opportunity for good interpretation and something that we can use to manage mastitis. Next, we'll talk about determining the factors that are affecting mastitis. What are the risk factors associated with mastitis on a particular farm, and how can we identify methods of preventing this and managing this better? So there's a variety of things happening on a farm, from milking routines, equipment, environment, bacteria, cows. There's some that we can easily have some control over: milking routines, making sure that we're getting good teat dip coverage, making sure we're getting good bacterial kill during teat dipping. There's other things that we don't have so much control over, as far as where a cow is necessarily going to lie down and what it's going to come in contact with. So we've got a poll question.
Yeah, here's your chance to vote, and I think we'll get this one pretty fast here, Abby. So get ready. How often do you change oil in your vehicle? We'll see how Doc works that in. 1, as recommended. 2, when the engine knocks. Number 3, January 1st every year. Coming pretty close now. When the oil looks coal black, when I think about it. So we got 5 choices here. Abby, which one do you do on your car?
Mike, I do as recommended, probably with a mix of when I think of it, when you kind of schedule it in, but try to follow the recommendation. How about you?
Yeah, I do the same thing. And I think, Jim, we got a good cross section here. So let's show Doc what the answers are, and then he can explain the question.
Looking good. So 87% recommended. So where am I going with this question? Well, it comes down to, we all know when it comes to our vehicle, whether it be a car, truck, tractor, there's some point in time where we have to do some maintenance on it. So my question to dairy producers and folks that work in the dairy industry is, how often is our milking system on your farm maintained and evaluated? We recommend that twice a year your system is gone through. If you think about some of these systems, especially on some of our bigger farms, these systems are running 24 hours a day, 7 days a week. Maybe they're milking for 22 hours out of the day and running 2 wash cycles, which are each an hour long. And so on many farms, what we'll see is the answer to when they maintain their milking system is when it breaks. Something to think about. We have control over our milking systems and milking equipment, and it's most important to make sure that our animals are happy being milked, and therefore we should, on a routine basis, do some equipment evaluation and maintenance. When it comes to people, the same thing. We need to spend time to make sure people understand what it is that they're doing, why they're doing it, making sure that they're doing a good job with milking procedures, stall maintenance, and environmental maintenance. And as far as the cows, we've got a couple of things that we can do on a routine basis to check to make sure things are going well with these animals. Most importantly, are they happy being milked? And we're going to talk a little bit about these as far as teat end cleanliness, teat scoring, strip yields, and udder cleanliness. So these are a couple of the cow side data that we collect on a routine basis so that we can link our cultures to how these organisms might be getting into the udder. First thing we're going to talk about is udder hygiene. And it's amazing how often folks that are on a farm on a routine basis don't really have an opportunity to stop and look at the cows. And I recommend that you get a new set of eyes to look at your cows, because over time, what you're used to seeing becomes normal. And so having a new set of eyes come out and look at animals is really key. And what this looks at is the visual assessment of how much organic matter, dirt, debris, and manure is on the skin of the udder. What we recommend is looking at 20% of the herd, or 80 cows. You can do it in the barn, you can do it in the parlor, you can do it as they're walking by. So it's pretty easy, but it's something to stop and do. What we find is with poor udder hygiene, we have a harder time at milking, cleaning those teats. And so if we send a cow to a parlor with a dirty udder, the milker has 2 options. 1, keep doing what they're doing and hope for the best and clean it the best they can, or take more time, do a great job of cleaning, but yet slow down the milking process. And so udder hygiene is really key. And with worse hygiene, we see a higher risk for mastitis. So here's two udders. Here's some dirty teats. Here's a clean teat. If we were to take a swab and swab a 1 square centimeter part of this teat, and we culture that swab, we can get millions of bacteria per square centimeter at the start. After a good thorough job of cleaning and disinfecting that teat with teat dip, and we do the same swab, maybe we can get it down to 150,000 colony forming units per square centimeter. We start with a clean udder, maybe we start out with 100,000 colony forming units per square centimeter. After, maybe we drop it down to 15,000. So the point take home is these are never sterile. There's always bacteria on the teat ends. And so our job is to try to reduce that load as much as possible during the milking process. We use udder hygiene scoring chart. If you look at these online, this one is from the folks out in Wisconsin, where you go through and you can look at the different the udders with and judge their debris. And what we're looking for is, I liked less than 10% of a 3 or 4 score. So I really push that farms should be able to 80 to 90% of the herd should have nice clean udders. If they don't, things that we need to look at is what the animals are hanging out in when they're not being milked. Are they walking through areas? Are we spraying down the deck and spraying udders with manure and debris? And stall maintenance and how animals hang out in their environment is key as well. When it comes to udder hygiene, it's important to look at different groups. It's also important to look at dry animals as well as our heifers. And it's an opportunity for us to look at bedding frequency, stall grooming, an area to decrease bacterial loads in the environment. We can also take samples of that bedding and set it up for culture to look at what happens to bedding over time. And here we have a bulk tank with the bacteria that we detected in the bulk tank. Here we have new bedding, unused bedding, and you can see the organisms that were detected there. And here we have used bedding after a period of time. And if we look, you can see that the new bedding started out with 879 coliforms, but over the course of a couple of days that this bedding was in the stall, it rose to 229,000 colony forming units per gram. So that's quite an increase. So with this kind of knowledge, and especially if we're dealing with, say, coliform mastitis issues, we've got methods of better handling our bedding, maybe using a lime additive, et cetera. And so when it comes to taking these samples, we take a couple of handfuls from representative stalls throughout the barn, avoiding manure piles that are going to change our numbers there. Another thing we look at is teat end cleanliness. And this is where we use an alcohol swab right before the unit goes on and look at how well the milkers are prepping these animals. And so if there's still dirt and debris when the unit goes on, this is opportunity for organisms to end up in the udder and cause infections. And so there's a number of different studies. Here's a French study on some French dairies where we know the cleaner the teats, the lower somatic cell. So as we go from very clean to very dirty, we also see rise in somatic cell. Here's how we do it. We use gauze with a little bit of alcohol. We swab the teat, and what we want to see is less than 10% with manure and other debris right before the unit goes on. And here we have another poll question.
Okay, we can take a break there, Mike. And the question is, which should you perform first during udder preparation? We have 3 choices, so that'll make it go a little faster. 1, pre-strip. 1 is pre-strip and dip, or it really doesn't matter. So the first one is pre-strip. Second one is pre-dip. And the third choice is doesn't make any difference. Do whatever you want to do. So we're off and running here, and we're getting some votes in here. Abby, what do you want to do first?
That was a tongue twister for you, Mike. I am going to say pre-dip. dip, but I'm very interested to hear what Dr. Zurakowski says about this. What do you say, Mike?
Yeah, I hear you as well. When we worked in our parlor here, I know if you dip first, it's much easier to strip the animal because you have a dry teat at that point. But anyway, we got enough votes in. Jim, let's share this with Dr. Mike. And what do you think of the results? Any surprises here?
So we have 36 pre-strip, 56 pre-dip, and 8 doesn't matter. And actually, the answer, that get the question a lot, and there's been a number of studies that have occurred, and the answer to it is it doesn't matter so long as you're doing both of them. And so when we look at a removing of organisms from the teat end or reducing the numbers, both pre-dipping and pre-stripping are important. Whether you do one or the other really doesn't make a whole lot of difference from a bacterial load standpoint. But we do want to do both so that we have well sanitized teats and good stimulation for milk letdown. Just to go real quick through a typical udder prep, we strip or dip and strip. We want a good stimulation. We've got a 30-second, minimum 30-second contact time for the pre-dip, so we have opportunity for that dip to get incorporated into the bacteria and destroy them. We need to leave a lag time, 1.5 to 2.5 minutes, to allow for milk letdown, and then we attach. So the other thing that we spend a lot of time looking at is whether the animals are happy being milked. And the best way of figuring this out is when the unit comes off or we're done milking, have someone grab a hold of her teat and strip it out. And I usually get a milker or a herds person or an owner to help me with this because they know right away whether these animals are happy or not. And what we'll typically do is we'll take a measuring cup and we'll strip for 15 seconds on each quarter, noting if there's one quarter that has a lot more milk than the others. And you learn really quickly whether she's happy or not. If she's not happy, she'll try to kick you. What this looks at is, are we leaving the units on too long? Is it an automatic takeoff issue? Is it a training issue that needs to be adjusted? What we want is animals to be happy when they're being milked, not painful, and we don't want to do any damage to teat ends. So what we recommend is that 80% of cows should have at least 150 to 250 milliliters, or about a half a cup to a cup total of the 4 quarters. If we're finding that we're having a low amount of milk in these, usually it's a system issue, maybe a milking issue, an opportunity for retraining or adjusting the system. The concept of trying to suck out every drop of milk out of the quarter, we're trying to change that in that, the minute we stop milking, more milk is going to be made. So let's leave some in there. We'll get it on the next to milking, but in that process, by leaving some there, we're not going to do any damage to the teats, and we're going to make this a happy experience for these animals. One of the reasons we want to make sure we're not doing any damage to the teats is we want to have good teat end condition. So teat end condition, referring to immediate effects after milking and long-term effects over time, they can be associated with milking equipment, faulty milking equipment, poor vacuum. It can be also milking management, over milking, and the process there can be an environmental factor. There are some cow factors, and this is definitely a risk for new intramammary infections. Why does it matter? Well, we know that when we have these short-term, medium-term, and chronic effects, that it takes longer for teat canals to close because of the damage that are associated with it. And so as we send this animal back into the environment, this opens the door for infections to occur. So here's just a few quick pictures as far as teat color, all right? The blue coloration here, swelling at the teat base. Here's some petechial hemorrhages associated with a high vacuum. And here's a hard teat that's been over milked. And if you think about it, if you were to try to strip milk out of that teat, it's probably going to be quite painful for her, and a bad experience for her and a bad experience for you. Over time, these short-term, medium-term effects can become chronic chronic effects, where we can have dry, abnormal skin. We can have hyperkeratosis, where we have a thickening of the keratin layer. We can also have open lesions. And so anytime we see these slightly rough or very rough teat ends, this is an area of concern for us to dive deeper into it as to whether this is an equipment issue, a milking issue, environmental issue, etc. There are teat scoring charts that are available. Look on the internet. What we want to see is the majority of our teats is in these two categories, a 1 or a 2. A little bit of a ring is actually preferred, but we certainly don't want to see any of these rough or very rough. And so again, we've got the 80-20 rule where we recommend doing 80 cows or 20% of the herd, but also looking through all the lactations that are present in the herd, whether this be, the younger animals to the older animals, and see how it affects them. If we're seeing greater than 20% of the animals with some teat abnormalities, this is a big concern that we need to jump into and try to find out the reason why. Open lesions, if we're greater than 5%, there's a concern there as well. So when it comes down to the risk factors, things for mastitis, things that we need to take into consideration. We're dealing with contagious organisms, or are we dealing with environmental organisms? Do we have teat end conditions that are going to open the door for mastitis cases because of delayed teat end closures, or roughened teat ends that are going to house bacteria? Are there milking procedure issues, treatment issues? We do see some differences between stage of lactation, and there are also other diseases that can take place on the farm that can cause immunosuppression of the animal's immune system to not be competent to fight off some of these infections. And if we look at what the contribution, how these areas can contribute to mastitis, what we can see is the cow only accounts for 20% of the contributions to mastitis. The other 80% are things that we have power over, as far as how the farm is managed, milking management, milking machine. So whenever we have high levels of mastitis or mastitis issues, we can't really blame the cow. We have to look at ourselves first. So now we know what the pathogens are affecting our herd because of our cultures. We've gone through and looked at some of the risk factors associated with them. Whenever we're developing a mastitis management plan, I always recommend that we include the staff and the veterinarian to help develop it. If we're dealing with contagious pathogens, the most important thing is identify the infected animals and prevent transmission to the herd mates. And then based on what organisms that are there, we can decide on a treatment or management decision. If we're dealing with environmental pathogens, we want to look at housing and hygiene, parlor milking improvement, teat end conditions, and then again, based on the organism, we have different management and treatment techniques for them. So here's a typical mastitis management plan. Get a case of clinical mastitis, collect a sample. If we're dealing with a mild or moderate case of mastitis, mild meaning only abnormal milk, moderate meaning abnormal milk and abnormal udder, maybe we take that sample, we don't do any treatment, and wait for culture results before we move forward. If we're dealing with a severe case with an abnormal milk, abnormal udder, and an abnormal cow, then we're more worried about systemic treatment and preventing this animal from getting toxic and sick. So we're talking about pathogen-based treatment decisions for clinical mastitis. So identifying the organism, and then based on the organism, we know where it's coming from, and we have different management techniques to deal with it. Why would we want to do this? One, we can save some money on treatment tubes and labor. It allows us to sell more milk. We have a decreased use of antibiotics and residue. And also there's a consumer and public pressure that we have to do a better job when it comes to antibiotic use to mitigate the risk of antimicrobial resistance. Why does it work? Well, most of the cases that we have of mastitis are mild or moderate. If you think about a case of mastitis, you generally think of those really bad cases of mastitis. But in reality, 85% of the cases are mild or moderate. And if we wait a few days, at 24, 48 hours for a culture result, we don't see much of a difference in the outcome. Those 15%, they needed to be jumped on right away with supportive therapy. And here's a study of 622 cases from 52 farms in Wisconsin. The cases were scored as mild, moderate, and severe. And if we look down through, we see that 85% are mild or moderate, 15% are severe. Here's our no growth. You can see most of those are mild. The severe cases, E. coli or coliforms, Klebsiella, Enterobacter, and a little bit of Staph aureus over here. If we look at treatment options for cases, here's a breakdown of a bunch of different organisms. Here's our 25% or so of no growth, so we're not going to treat there because there's no organism present there. Here's E. coli, grade 1 and 2. No treatment really recommended. Enterobacter, yeast, etc. Here's our severe cases of E. coli, where this is going to be a systemic treatment. Here's that maybe 25 to 30% that would actually respond to antimicrobial treatment, or some of our environmental streps, some of our low-grade Kleb infections, and our coagulase negative staph. We're not going to treat our chronic Staph aureus or mycoplasma, etc. And so when it comes to treatment protocols, what we find is, or treating with antibiotics, what we find is only 20% of the organisms that can cause mastitis are actually going to respond to any of the treatments that we have available. So we've done some studies looking at this, comparing blanket treatment, where every case of clinical mastitis is treated, to selective treatment. So we culture the organism and treat only the ones that will respond. And what we see is there's about a 67% reduction in antimicrobial use, which equates to about $30,000 per 1,000 cows. And here is a breakdown. We won't have time to get into it too close, but a breakdown of the economics taken in consideration: the cost of treatment, labor cost, the culture cost, lost milk income, and basically the difference between a blanket treatment of treating everybody, and this particular farm is a 5% clinical mastitis rate. The difference is about $30,000. So a sample mastitis protocol, one that we would typically set up on a farm. Clinical case of mastitis occurs. We look to see if there's a history to make sure this isn't a chronic case. So we look in the past 14 days. If there's no previous record of a case, we take a sample. If it's a sick animal and needs systemic treatment, we jump right on that. On this particular farm, if they had any of our contagious organisms, strep ag, Staph aureus, myco, or prototheca, this particular farm, they called these animals. If they were our strep organisms, strep species, Lactococcus, Discalacti, Uverus, and Enterococcus, or staph, coagulase negative staph, they underwent specific treatment protocols. And if they were our other organisms or no growth, they were kept in the hospital pen until the milk was normal in appearance, and then released. So those are our talk.
Again, thank you, Dr. Zurakowski, for that presentation. And we really appreciate all that you shared on milk cultures and how you can use that to treat mastitis on the dairy farm. I think that will be very useful information for our dairy farmer listeners and all those who work and consult with dairy producers. So once again, thank you very much. I would also like to extend our warm thank you to Ozalea for their support of this program. We really appreciate them being a sponsor for us this month and helping us support and provide these educational programs. So if you'd like to learn more about their company, you can find information in the handout that can be printed out, or you can visit them on their website. If you would like to watch this webinar again or share it with somebody else, or if you would like to see any of our past webinars, they can all be found in our archive, which is available on our website, hoards.com, and there's a webinar tab there that you can visit. So feel free to check out all of our archived webinars that we have done so far since we started our series in 2011. I hope that you'll make plans to join our next webinars. So if you go ahead one slide, thank you. In November, on the 9th, we will have a feed and forage outlook, which will talk about the 2020 harvest season and what that means for feed in the coming year. Our presenters will be our very own Mike Hutchins from the University of Illinois, and then Mike Rankin, who is our Hay and Forage Grower magazine managing editor. And that presentation will be sponsored by Kuhn. In December, we will have a presentation focusing on dairy cattle nutrition, and our presenter for that one will be Dr. Bill Weiss from The Ohio State University. The sponsor for the December webinar is QLF, Quality Liquid Feed. So if these topics interest you, we hope you will mark them on your calendar and make plans to attend. Now, before the webinar, we did have some questions that came in. So we have those on slides here, and Mike will read through some of those. And then we also have some questions that came into the questions section, a lot of questions actually. So Mike and Dr. Mike will go through those and answer as many as we are able as time allows. So Mike, go ahead with the questions, please.
Yeah, here's our first question that came in, and we encourage those to come in. In a typical herd, what is the normal percent of cows with mastitis that need antibiotic treatment? And what percent is for reason for concern? And then the follow-up question is a two-parter. What percent of these cows with mastitis end up being culled? So Dr. Mike, responses?
Yes, most of our farms, we really try to push for 5%, 2 to 5% mastitis rate. We do get nervous when mastitis rates go between 10 up to towards 20%. As far as which would require antibiotic treatment, again, it comes down to the organisms that are there. And again, if we look at all the organisms that cause mastitis, only 20% will respond. So if we do have our strep organisms, most of the time, the strep organisms in our coagulase negative staph are the ones that mostly receive treatment. As far as culls, related to mastitis and udder health, we should have it less than 5%.
So a follow-up comment, what about that 5%? What if you get repeat cows? Is this original cows when you say 5%? Or if a cow has mastitis and she comes back a month later, is she counted in part of that 5%, or is she just counted once?
Well, she would just be counted once because that would be a long-term chronic infection that she would be dealing with.
Okay, let's go to our next question. And it says, how do genetics play a role in mastitis infections in milking cows?
Well, when it comes to genetics, I'm probably not the best person to answer this, although I try to keep up with it. I know they've looked at different methods for resistance and looking at genetics and resisting mastitis. I don't think it has been all that. There's been limited success with it. I know lately folks are looking at teat end design, shape, and length from a genetic standpoint, because we do see that as a key part. But if anyone else has any additional information when it comes to genetics, please chime in.
I would think perhaps maybe depth of udder might be a factor too. You know, deep uddered cows could,
Yep.
you know, and that could end up being a factor too. Let's try our next one. Okay, this one comes from Pakistan, and it says, we have dry lots and it rains a lot. We use pre and post dip, but we have a 10% incidence of mastitis year round. How can we minimize our mastitis cases? And then we'll get the second question after the first one, Dr. Mike.
Yep. So my first question is, what are the organisms are we dealing with? Are we dealing with contagious organisms that are just getting spread around, or are they directly related to the rains? And I'm assuming muddy, wet conditions. Are these environmental bugs? Assuming that we're talking about environmental bugs, again, things that we can do pre and post dip are going to be key, but we're going to want to make sure that we're doing well in the parlor. We're going to see where these animals are housed, if there's a way of eliminating one of those basic needs of moisture, food, warmth, and pH. Might be difficult, but there might be an area for area of opportunity there.
His second question is, what are your thoughts on dry manure solids for bedding?
The key word there is dried. And so we have a lot of farms that do well with this. Dried manure solids has great nutrition source. Of course, there's warmth in the summertime here in New York. There's also warmth where the animal lies. pH is good. The key is dried. Once we add moisture to that, it becomes a great environment for organisms to thrive. And so it can be done successfully, but again, it comes down to those 4 elements. Sometimes adding a pH adjuster like lime, which will pump up the pH, make the pH rise, makes it a bad environment for these organisms. So it is possible to do it. Maintaining it as dry is often one of the biggest challenges.
Okay, I think we have one more, maybe 2 more. One for the Philippines. How do you handle Mycoplasma mastitis?
So Mycoplasma mastitis is a problem that we deal with quite a bit. When it comes to, the rest of the question goes on that it's not in the Philippines here, it's not a test that's easily accomplished. And what are the definitive signs? Couple of things. It's often hard to identify this without true cultures. One of the things that we see where I start thinking about Mycoplasma mastitis is if we see an increasing somatic cell count with non-responsive mastitis. So we've got cases of mastitis and we're trying to use a treatment and we're not getting ahead of it. We're not seeing any improvement. One of the things, clinical milk with mastitis, one of the things that we sometimes see is when you take that sample and you let it sit, there will be a sediment at the bottom of the milk sample. Kind of looks like sand. And so that's not all samples will do that, but if we do see that, that's usually a dead giveaway that we're dealing with mycoplasma. The other thing is respiratory infections. And so I'd mentioned earlier that about 98% of the infections in mastitis come up through the Teat canal and into the udder. That 2% that are unaccounted for are generally mycoplasma issues where we have a respiratory infection. Mycoplasma is a normal organism of the respiratory tract. We get an infection, it turns to mycoplasma pneumonia, circulates through the bloodstream and lodges itself in the udder. And so something to think about if you're dealing with respiratory infections, you hear coughing on the farm, in addition to worrying about what's happening in the lungs, think about what's happening in the udder as well and see about doing some culture work.
Okay, let's go down. I think that's the last one. Now we go to the speed round. And let me tell you,
Okay.
Dr. Mike, you've got a boatload of them here. First of all, do you advise using potassium hydroxide for identifying gram-positive and gram-negative? Is it accurate in terms of testing?
Absolutely. So one of the things I talked about, gram stain differentiating gram-positive and gram-negatives. It's a great test. We rarely do it because it's time consuming. The alternative is potassium hydroxide. And what you do is you take a little bit of the organism, you take a little bit of the potassium, you goop it around, and what it does is it digests the cell wall and you get a big string if it's a gram negative, you don't if it's a gram positive. So a very effective method of differentiating gram positive from gram negative. Good question.
Wow. Yeah, cool. What organisms are you likely to isolate when you culture bloody milk samples? And he says for mastitic cows, so the cow must have mastitis, not just fresh cow.
So there are certain organisms that utilize the iron core in a hemoglobin molecule in the red blood cell. So in blood, we have a red blood cell. We've got a hemoglobin molecule that holds on to oxygen. In the core of it is an iron molecule. And there's certain organisms, Staph aureus is one, Truparella pyogenes is another. They utilize that iron to help them reproduce. And so there are some organisms that love raw tissue. When they're in the udder, they'll find a blood vessel, punch a hole in it, and utilize that blood to help them grow. And one of the reasons we use blood auger plates is we can utilize the red blood cells to help certain organisms grow. And when they do break down those red blood cells, we get these zones of hemolysis or clearing on the auger. And so typical organisms that will do this, Staph aureus and Truparella pyogenes are 2 key ones. We also will see some hemolytic E. coli, so they will do that. And then there's some other things like Pseudomonas that will do it as well. But generally, Truparella or T. pyogenes and Staph aureus are generally our 2 biggest candidates for that.
Fantastic. How do you calculate the mastitis incidence percentage for the whole year? Any tricks of the trade? And I assume it's clinical mastitis, or you comment?
Yeah, I think what we're talking about is clinical mastitis, and looking at the monthly rate, and then we calculate it to the yearly rate.
Okay, for a quality milk, what somatic cell count do you want your good herds to be under? If they really doing a good job as far as subclinical mastitis.
So we use 200,000 somatic cells per mil as our baseline, and so we like to see herds under 200,000. That said, we've got some herds that are under 80,000 annually. So that's usually the 200,000, or a linear score of about 4.0 is where we typically want herds to come in under.
Okay, a question from a German dairy farm, from a German listener. They said, what's your opinion on the teat brush scrubbers as far as that goes? On the large German farms, they use them with good success, but they have stopped stripping or pre-stripping. Thoughts on either of those?
So from a stimulation standpoint and cleaning standpoint, they're phenomenal. They do a great job. And you know, when it comes to pre-stripping, there's a couple things that reasons we do it for. One is early detection of abnormal milk, right? Because we're actually looking at. Two, we're getting rid of some somatic cells and some bacteria that settle in between milkings. And also three, from a stimulation standpoint. So those scrubber brushes, they do a great from stimulation standpoint and udder prep and cleanliness, but not necessarily give you the opportunity to look for the early signs of mastitis. And again, if we can catch a case early and culture it, we can usually get a good idea of the organisms. If we wait till it's really clinical, lots of flakes and clots, our ability to detect it goes down because the organisms can be encapsulated and dead.
Very good. What should the bedding pH be to try to minimize bacterial growth, especially in sand bedding?
So most beddings just in the environment are usually around 7. When we use a bedding additive like lime, I've seen the pHs go up to almost 11 on some of these. So what we're doing is we're adjusting that pH. And again, most bacteria like that 6, 8, 7, 2 range. You take it out of there and they die pretty quickly. And we do this in the lab where we spike bedding samples and look at pH over time and look at bacteria growth over time. And we can see there, once you get up much higher than about 7.5 or so, we see bacteria levels drop down pretty quick.
And a related question, when you say limestone, are we talking a certain particle size limestone? And is that the product of choice as far as economics?
Usually what we're looking at is use of hydrated lime. So it's a little bit easier on the teat ends. It is powdery, but you know, it's important to mix it into the bedding. And the other thing is it's really only good for about 24 or 36 hours before its abilities are diminished. So if we're going to use it, we need to use it on a regular basis or routine basis.
Okay, here we get to go even faster. What are the field tests we can conduct to check our parlor clean in place or CIP efficiency?
So there are a number of different wash system analysis. We have a service that we do. It usually takes quite some time to go through, and we look at the slugs going through the system, and we collect samples and look at pH of the system through time. So the other thing is to stop and look at gaskets and connections in the system as well. Make sure that there are not any slipped gaskets or other issues associated with the system.
Okay, here's another fun. What would you look for if a herd has a high proportion of their first lactation animals freshening with mastitis or getting a high rate of infections very early in the lactation in these first lactation heifers or cows?
Yep. So one thing is to look at, again, hygiene leading up to their freshening, right? Where are they housed? How are they handled? Certain organisms we know can adhere to tonsil tissues. And if we've got calves that are able to suckle, we can deposit organisms in the developing mammary tissue. And of course, when they freshen in, we can have issues. And one of those organisms is Staph aureus, one of our contagious organisms. So I would look at hygiene of the animals prior to freshening, look at how the calves are managed over time, and also where are they freshening. I've seen some farms where they use certain units or bucket milkers to freshen these animals in, and these units are dirty and have caused infections in these animals right at the start of their lactation.
Okay. Do you think herds should be vaccinated before mastitis? Blanket the herd. I'm not sure if this is J5 or your comments, but vaccinating for mastitis.
So if we look at our JVAC or J5 vaccines, they're specific for E. coli, coliform vaccines or coliform mastitis, and based on a section of the cell wall. And we found these have been very good at reducing clinical signs. It doesn't reduce the number of cases. It's just we don't see the clinical signs in those. So I'm assuming that's what we're talking about with those. And we do. If coliform mastitis is a problem on your particular farm, we found that these vaccines can do a great job in reducing the clinical effects of these infections.
Do barrier post dips really help?
They do. Again, we have to look at teat end condition first. If we have really roughened teat ends, there's no teat dip or post dip that's going to make is going to fix everything. So if we have roughened teat ends, we need to go and chase why we have roughened teat ends. If we've taken care of that, these barrier post dips are great for providing protection over extended periods of time. But nothing will beat making sure that our teat end conditions are good.
And maybe a related question, which chemical base do you recommend for pre and post dip? Same type of products, same background products? What's your thoughts on that?
Well, I get that question a lot. We do a lot of teat dip efficacy testing here in our lab, which means we take teat dips, we grow up batches of really bad organisms in high quantities, and we look at kill rates over time. What we found is it doesn't necessarily matter which compound it is. One of the factors that affects its efficacy is the presence of organic matter. Okay, so if we get a lot of manure, dirt, and debris on the teat ends or in the dipper cup or in the spray bottle, the killing ability of these compounds is diminished. Doesn't matter what it is across the board. So hygiene of your dipper cup, and I recommend every 6 months throwing away your dipper or sprayer or whatever you have and replacing it. Hygiene is key. More organic matter and debris, harder it is for these compounds to do their job.
Your very last question, you talked about limestone for sand. Is there any other chemical materials you could use for sand bedding to kill bacteria besides limestone?
Well, I know there have been a couple of different companies that have been trying to develop additives over the years. I don't know that any have been all that successful, and so we still go back to the lime at its for trying to make rough environments for organisms to survive.
Well, Dr. Mike, you did a yeoman's job. Abby, I think we'll turn it back to you to kind of wind up today's webinar.
Thank you. Yes, a lot of good questions came in. Thank you to everyone in the audience for being such active participants, and hopefully we were able to answer most of the questions. Once again, I'd like to thank Dr. Mike Zurakowski from the Cornell Quality Milk Production Services Lab for being our presenter for this month. You did a great job with the presentation and then answering a large amount of questions afterwards. So Dr. Mike, thank you so much for spending your time with us today. Also, I want to extend one more thank you to Ozalea for their financial support of this webinar. Again, we're very thankful to have them on board as a sponsor of our webinar series this month. Looking ahead, our presentation for November is a focus on feed and forage, and then what the harvest season of 2020 brought us and what that means for feeding dairy cattle in the year ahead. So please make plans to attend that presentation, and the sponsor for that one is Kuhn. And then in December, our last presentation of 2020, we'll have Dr. Bill Weiss from The Ohio State University talking to us about dairy cattle nutrition with a sponsor for that presentation of QLF. So please, once again, mark your calendars. And last but not least, I want to thank all of you out in the audience for joining us today. We have people from all over the United States and all over the world, and we really appreciate you taking time to join us for our webinar. And we hope that you took some useful information and can use that on your dairies wherever you're located. So from all of us here at Hoards Dairyman and our team at the University of Illinois, I'd like to thank you for participating in today's webinar, and we hope that you will join us again in the future. Until then, please take care and stay healthy, and have a good rest of your day.